All right, so now I'm going to talk to you a little bit about incubation and transmission. Incubation is interesting. Most cases occur 4 to 5 days after exposure, but there's an estimated range of somewhere between 2 and 14 days. So we're not really sure why, but in some patients that incubation period is different. On average, considered around 4 to 5 days. The median is around 4 days, and that's from 1,099 Chinese cases that were examined through the end of January. The median of patients that will develop symptoms is around 5 days. So 97% of patients will develop some symptoms within 11.5 days, but most patients, more than 50%, will have symptoms within 5 days. Transmission is really important. So we know that person-to-person transmission occurs via droplet precautions, so precautions for droplets are key. If you think you're sick, wearing a mask protects other people from you. If you're not sick and you think you're around someone who's sick, an N95 mask is the only mask that will protect you from the virus in the air in a droplet form and in an aerosolized form. And you also have to wear eye protection, and of course, and avoid touching your face. There may be airborne spread of COVID, but we don't understand how that works, and the CDC has some guidelines on how to reduce or mitigate that risk. COVID can live on surfaces for up to 72 hours. You've all read about this at this point. Plastic, stainless steel have up to hours or days. The New England Journal article said that the virus can remain viable and infectious in aerosols, meaning in the air, for hours. So this is a pretty hardy bug. They found that there are secondary spread rates of 1.5%, 1 to 5%, and 0.45%. So secondary spread is spread via other methods other than aerosol or droplet, and it's really hard to quantify what that means. But we know that those rates are real, so there are other ways to get it from people that have it. This is the most important part of this discussion, that asymptomatic individuals have high viral loads. So there are people that don't have fever, that don't feel sick, that have the disease and are carrying it and actually secreting virus into the environment and coughing, sneezing, or breathing around you, and producing enough virus to get people sick around them. So there may be some pre-symptomatic and asymptomatic spread, meaning some people will give you the virus before they show symptoms, and some people will never have symptoms but could also give you the virus. Though unresolved, some estimates are showing that there's a substantial transmission by those asymptomatic and pre-symptomatic individuals, and that may be why it's grown so quickly and why it's so hard to contain in the United States. New data from Japan shows that the proportion of symptomatic individuals to asymptomatic individuals is high, and that the asymptomatic numbers may be maybe as high as 17% or 30%, depending on the study that you read. So the take-home message is, not everyone that has this virus has illness or feels sick, and so it's really important to wash your hands and maintain the social distancing in order to flatten the curve and reduce the amount of transmission of the virus.